All right, let's talk about something that can ruin a perfect beach day in a split second, the jellyfish sting. It's one of those things that happens all the time, but surprisingly, a lot of us have no idea what to actually do about it. Well, in this explainer, we're going to change that.
So, picture this. You're out there enjoying the waves, and then, bam! You feel this sudden, sharp, burning sensation. What was that? Did you scrape a rock? Did something bite you? Well, chances are you just had a run-in with a jellyfish. Let's break down exactly what's going on, and more importantly, what you need to do next.
Okay, so first things first. A jellyfish doesn't bite. It's not an attack in that sense. What's really happening is a very fast biochemical reaction. The second its tentacles make contact with your skin, thousands of tiny microscopic cells fire venom directly into you. It's a defense mechanism, and knowing this is the key to treating it the right way.
So let's dive a little deeper into the science of that sting. What is actually happening at a microscopic level when those tentacles touch you?
This is the best way to think about it. It's not one single sting like from a bee. No, it's way more intense. It's like your skin has just been hit by thousands of tiny venom-filled harpoons, all firing at the exact same time. It's a seriously efficient and obviously painful biological weapon.
And those little harpoons, they have a name, nematocysts. Each one is a tiny capsule on the tentacle, and inside there's a coiled, spring-loaded needle. The slightest touch, like from your skin, is enough to trigger it, firing that needle and injecting venom. And here's the really crucial part. They can still fire even when the jellyfish is dead and washed up on the beach. So whatever you do, never ever touch one. Of course, not every sting is a 5-alarm fire. How bad it gets really depends on a few key things. First, the type of jellyfish is huge. A sting from something like a box jellyfish can be lethal. Then there's how much of your skin got hit, your own personal sensitivity, things like allergies, and your overall health. And it's worth knowing that kids and the elderly tend to be more vulnerable.
Okay, so how do you know if you're just dealing with a painful but manageable sting versus a real medical emergency? It all comes down to knowing the difference between a local reaction and a systemic one. Let's break that down.
So on the left, you've got your local symptoms. This is what most of us will get. You've got that immediate, sharp pain, some redness and swelling, intense itching, and sometimes you can even see these grid-like marks from the tentacles. It hurts, for sure, but it's contained to that one area. Now look at the right side. These are systemic symptoms. This means the venom is affecting your whole body. We're talking nausea, headaches, muscle spasms, and the biggest red flag of all, any difficulty breathing. And this is probably the single most important takeaway here. If you or anyone you're with starts showing any of those systemic symptoms, you don't hesitate. You don't wait to see if it gets better. You treat it like the medical emergency it is and get professional help right away. All right, so the sting happened. The shock is wearing off. What do you do right now? Let's go through the exact step-by-step first aid that will stop the pain and keep things from getting any worse. Okay, 4 simple steps. 1, get out of the water, calmly and safely. 2, if you can see any tentacles left on the skin, you have to get them off. But, and this is a big but, don't use your bare hands. You'll just get stung again. Use gloves, tweezers, even the edge of a credit card to scrape them away. 3, rinse the area, but only with salt water. And 4, apply heat. Soaking the sting in hot water, as hot as you can handle without burning yourself, so around 45 to 50 Celsius for 20 minutes or more is the goal. This helps break down the venom proteins. Seriously, if you walk away with just one thing today, let it be this: salt water and heat. These are your 2 best friends in this situation. They are the tools that actually neutralize the venom and stop more of it from getting into your system. And now let's talk about all the things you shouldn't do. Because there are a ton of myths out there about treating jellyfish stings, and frankly, some of them are not just wrong, they can make things a whole lot worse.
Let's tackle the big one first: peeing on the sting. Nope, just no. It's not proven to work, and the chemical makeup of urine could actually trigger more stinging cells to fire. What about fresh water? That's another huge mistake. It causes a change in pressure that makes any leftover stingers release their venom. Rubbing sand on it? All you're doing is grinding those stingers in and causing more pain. And finally, ice. It might feel soothing for a second, but heat is what actually breaks down the venom. In fact, some studies show ice can actually make the venom's effects more painful.
So the bottom line is pretty clear, right? Following that old folk wisdom could really backfire. You've got to stick with what the science actually shows works: salt water and heat.
But hey, you know what's even better than knowing how to treat a jellyfish sting? Not getting one in the first place. So, let's wrap up with a few quick tips on how to stay safe out there.
This is all common sense, really. Pay attention to the warning signs and flags lifeguards put up. If you're going to be swimming in an area that's known for having lots of jellyfish, wearing a wetsuit or even just a rash guard can provide a fantastic physical barrier. And, I'm going to say it one last time because it's that important, do not touch the jellyfish you see washed up on the sand. Those stinging cells can stay active for a long, long time.
So, let's do a super quick recap of the most important things to remember. 1. Get out of the water. 2. Get any tentacles off without touching them yourself. 3. Rinse with salt water. 4. Apply heat to the area for at least 20 minutes. And 5. If there's any sign of a serious reaction like trouble breathing, get medical help immediately.
Look, the ocean is an incredible place, and a little bit of fear shouldn't stop any of us from enjoying it. Now you know the science, you can spot the warning signs, and you know the right first aid. You're not just a beachgoer anymore. You're prepared. You've got the knowledge you need to handle one of the ocean's most common hazards, so you can get back to focusing on the adventure.